explain me please something. Look, for example, sometimes I'm feeling dizzy, and because I've been in my country and I did lots of blood tests and all this stuff. The doctors told me that it's because of these vessels, blood vessels from the back of the
neck.
Of the neck. Yeah. What do you think about this?
Most of my clients that see me who get low blood pressure, often it's due to dehydration. They're just not drinking enough water. And when I ask them, "Are you drinking enough water?" they always answer this in this way: "Yes, I drink lots of liquids." And then I'll ask them, "How much exactly? Quantify how much you drink." And they'll say, "Oh, you know, I drink maybe a glass of water at night, and I drink some tea and coffees and stuff, and I feel great. You know, I don't feel there's anything wrong with me other than this dizziness." But ultimately, we're made up of water. And if your water goes low, then you can expect everything to be dehydrated, including your joints and obviously the blood that runs through your body. So if you looked at the blood, it will be thicker and not as much thinner if you're drinking enough water, if you're hydrated.
And because of these vessels, they are quite thin. I think it's much difficult for the blood to go up.
I'm going to suggest to you that's a different thing. So the dizziness and the neck problem could be two different things.
Really?
But you'd need to have a consultation where we could discuss that in a bit more detail.
Because of these vessels, they are too thin, and there is not enough space for blood to go up to the brain.
So if you are hydrated, your blood is thinner,
yeah.
and your blood pressure would go up and be able to push that blood through. Perhaps it's that.
Okay.
So your vessels would be actually larger.
Yeah.
Because the blood pressure is making them larger, you're getting better volume through, and the blood is thinner.
That makes sense.
That's a cap.
You're trying to push thick blood through small constricted vessels with low pressure. And then obviously your brain can't work as well as it could do because it's not getting the blood, the oxygen and all the materials it needs to keep it healthy. So you're lucky you're only getting headaches and dizziness. Generally, people don't like drinking water that much because it hasn't got the beautiful flavours in. You know, a lot of people much rather reach for a can of Coca-Cola rather than going for a glass of cool water. But ultimately, what we're drinking there is the basis of our bodies. With us being such a high percentage being water, it means that's what we are. So we're actually replenishing ourselves by drinking.
One more question. Is the same to drink water, tea, or other different types of liquid? Is the same? Or is not the same?
So for rehydrating your body, as long as you're taking on board liquids, then you're going to be generally okay. But caffeine in tea and caffeine in coffee means that your body has to work a lot harder to actually take out the liquid that it's going to transfer into your bloodstream.
It's going to overwork the kidneys.
Yeah, you're overworking your body, and it's already not working well. It can work. You're optimizing your body so much better by putting in fresh water, so it hasn't got to work at tidying it up, ready for your body to use.
What is happening in that moment straight away after I'm drinking the water?
So first of all, it's flushing through your system until it gets into your stomach, where not an awful lot happens at the stomach. Much more happens in the intestine, where it runs through the sides of the outside of the tissues that make up your intestine, and it's able to pass through and enter into the bloodstream.
So everything actually is happening in the intestines.
When you take on board a lot of medication, it doesn't do, often the medication doesn't do as much as you think in the stomach. It happens in the intestine.
here under the skin, in my head, I feeling like worms, small
Marbles?
worms.
2 marbles.
Walking.
Blood pressure.
Yeah,
Having you know,
Having only 2 marbles.
having 2 marbles is just not good, really. But there's not much we can do about that. No, but as you're taking on board the water, you're going to obviously feel the blood pressure possibly going up. There'll be a change, and that might be what you're feeling. But most people wouldn't feel that unless the blood pressure was very, very low. But yours
But
pretty
wait,
much is.
So, how it will work? So, 36 years from my life, I had this blood pressure. So between 19 and 100. And now, if I'm starting to drink more water, it's gonna go up.
Yeah.
Is it possible to change from now to change to be...
Absolutely, and generally your blood vessels will change as you get older anyway, and they become more restricted, and so the same amount of blood in your body, but it's been restricted now, so now the blood pressure goes up naturally.
Mama,
But if yours isn't, then you're learning more and more to work out dehydrated. Your body's doing its best to keep you alive, and don't forget that you're also, every year you live, your tissues are older. Your body's not working as well as it did, and your cells that have been reproduced aren't as fresh as Sarah's are at 4 years old. So that's the reason why blood pressure generally goes up as you get older.
So it
They're
means,
they're more elastic for Sarah. They're not as elastic for you.
yeah, it means when I'll be older, my blood pressure will go up because of the age also,
Yeah.
and I will feel awesome.
Yeah. Yes. Yeah. Because you've had
Because
such bad health for
usually-
such a long time.
Because usually at that age people are getting too high this blood pressure, but in my case it's gonna be opposite.
Yeah.
It's gonna be normal.
Occasionally I'll meet people, older people who have retired, and they tell me they're experiencing great health, but that's because they're actually drinking more. The juices are looking after their body is more important than waking up in the morning, rushing around, perhaps drinking a coffee, and rushing off to work, not drinking properly at work, not eating properly at work. Now they've got all day to look after themselves, and they feel the difference.
Is there any connection between cold hands and drinking water?
Alun,
But there's
I've not read about connection between cold hands and drinking water, but the more liquid you've got in your body, like I've said, is going to change your health. And the only best way of changing it and seeing whether it works is to test it over the next 6 weeks to 2 months. Drink more water and see if the blood pressure goes up, you get more blood to your fingers. We've just spent the day walking on some of the highest peaks in the Lake District, and we've managed to find this really beautiful waterfall. So this is Liberty Cap. So this is what we can often find. It's been used for literally thousands of years
stay.
as a medicine, and it's what's being used in the future for curing depression, clinical depression. Just reinventing the wheel.